Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
In this presentation, we will discuss the anatomy of the primary teeth. Our objectives in today's presentation are to identify these teeth by name and location and the positions of them, to discuss a little bit about the occlusion, and to discuss rather extensively the differences between the primary teeth and the permanent teeth, to discuss the morphology on some of these primary teeth, as well as the differences in terminology, and to get some identifying characteristics of some of these teeth. If we look to our skull here of a youngster of approximately 4 to 5 years of age, we can start to identify our primary teeth. We have 20 in number, and if we divide these down into quadrants of 5 here, we'll identify them individually. We have a maxillary right primary central incisor, our lateral incisor, and our cuspid. The anteriors are essentially the same. If we look to our posteriors now, we have a first molar and a second molar. This means that we have no premolars or bicuspids in our primary teeth, and we have no third molars. This just leaves 5 in a quadrant, with 4 quadrants will give us our 20 teeth. Now, in the permanent teeth, we identified these teeth by number for record purposes, and we had 1 through 32, starting with the maxillary right posterior tooth. In our primary dentition, we're discussing these teeth by letters, and we'll start with the maxillary right posterior, and this will be number A. And then we'll go, as we did with the permanent ones, around to the maxillary left posterior, which would be 10 letters around to the letter J. And we'll drop directly below to our mandibular second primary molar, K, and continue on around until we come to the 20th letter in our mandibular right molar, which would be T. I call these teeth primary teeth. You may well recognize that there are other terms for them. Deciduous teeth has been a technical term for these teeth for a long time and is in a lot of the literature. Primary teeth has been the more recently accepted official name for these teeth, and so we'll try to refer to them as primary, although still will refer to them as deciduous, I'm sure, because of habit. Also, these are called baby teeth, and of course parents most commonly know these as baby teeth and not by other terms, although they're continuing to be educated here on this. Frequently they can be called milk teeth. Some of these have gotten stained from the glue and dirt and what have you, but these teeth frequently are very white and oftentimes much whiter than the permanent teeth, so they're called milk teeth as a slang term. If we look to the occlusion on these teeth, we'll find essentially the occlusion is basically the same as the permanent teeth. Our mandibular teeth are smaller in the anterior, and they develop an arc which is inside of the maxillary arc, and they are biting to the lingual of our maxillary teeth. And this occurs all the way around. We have the same type of an overbite and an overjet situation in the anterior and in the posterior. We've got the buccal cusp of our mandibular posterior teeth occluding into the central fossas and grooves of our maxillary teeth. One thing in relation to the occlusion is a little bit different, and that is if we look all the way back to our posterior teeth, frequently we have in this area what is called a flush terminal plane. Our anterior teeth in the mandible are much smaller, but our mandibular teeth and the molars become much wider, and they help to make up for this difference, and oftentimes we'll end up with the same plane at the posterior here. This makes quite a significance in the eruption of the permanent teeth here. We might look to the eruption here a little bit. We've got a cutaway section, and if you take the labial plate, or cortical plate of bone, I should say, off of these skulls, we'll find that underneath we have a tremendous number of teeth developing. Got a central and a lateral and a cuspid, our two premolars, and all of these teeth are basically called succedaneous teeth, which is a term which we should identify and define. A succedaneous tooth is a tooth which replaces one of the primary teeth. One of the reasons we can call this 4 to 5-year-old is because these first permanent molars, which erupt at 6 years of age, are not quite coming through the bone yet. They're still down underneath the cortical plate of bone in some of the areas. The maxillary one started through. Our mandibular one is completely under the cortical plate of bone. Some people ask why we don't study the primary teeth first, particularly since they're the first in the mouth, as in this 18-month-old child. But there are many reasons. First of all, the primary teeth do not have well-defined landmarks or grooves, fossas, ridges, depressions. They're just not as distinct as they are in the permanent teeth. These teeth are generally smaller and harder to study from size standpoint, and the availability of them is not very good. The good fairy has a way of getting most of these teeth, and we have a hard time getting a selection to study. Our textbook lists the primary teeth after the permanent teeth, but they do have a rather large number of good diagrams and photographs which you may have to use to supplement your study on these teeth. We also have a fairly decent collection of these primary teeth in the Chident Center, which can be checked out for studying and looking at in the Chident Center. Let's look at the differences that exist between these permanent and primary teeth. We have 8 general differences. The first one is size. We've got some permanent teeth and some primary teeth next to each other, and just overall general size is very significant. This is obvious. We've also got a size variation in relation to the crown height. The crown height on these deciduous or primary teeth are very short and squatty. The distance from the cervical to the occlusal is considerably shorter in proportion to the permanent teeth. We can go back to the slides here. We can see that there is a number 2 difference, is a significant color variation. We can see some permanent teeth coming in down here, and they're oftentimes yellower. Our primary teeth are whiter, and this is where they pick up the term milk teeth. This is a big problem with parents when these permanent teeth usually start coming in on their first children. I bet you I've seen 100 of them or more in practice that come running in and say, something's wrong with my child's permanent teeth. They're all yellow. And there's supposed to be that difference, and you have to point out to them the difference and why. This also points out, I think, rather significantly the size variation. For instance, on our central incisor, the primary tooth, we're wider from the mesial to the distal than we are from the incisal to the cervical. This is one of the reasons why they're getting this short, squatty type of terminology to the crown. Third major difference is basically number. Again, an easy one. We've got 20 primary teeth. We have no premolars. We have the same 6 anterior, 4 mandibulars, and the 4 maxillaries, 6 of maxillaries, mandibulars. And then we have 2 molars. So the ones we're missing are basically third molars and our premolars. And these are simply termed first primary molar and second primary molar. You can see the first permanent molar starting to come in here in this section. This is not a deciduous tooth here. And very important that we learn the eruption of these, because parents don't recognize that these are not, as they would term them, baby teeth, and they're very frequently letting them get into a great amount of disease and trouble before they know that they're permanent. One of the things that's number 4 main difference is that our primary teeth have no mamelons. You can see permanent teeth here. Very strong mamelons when they first come in. Primary teeth have no mamelons, even when they're present to begin with. Fifth major general difference is in pulp chamber size. Pulp chambers in the primary teeth are proportionally larger than they are in the permanent teeth. And this is significant. Number six main difference would be that the enamel is thinner on the primary teeth. We can see how the enamel is thinner and rather even in comparison to the enamel on a permanent tooth. This is the first permanent molar here. This is your second primary molar. The enlarged size of these primary pulps becomes very important when removing decay and in preparing these teeth for restorative fillings. We've got a major root difference on these teeth. And actually we can divide this into three differences. So I've listed number 7 as root differences on the molars, molar root differences, and three basic areas. One is that the roots are widely spread, and you can see the succedaneous tooth developing right here, which would be your second permanent mandibular premolar, the number 20, developing right in between the roots of the primary teeth. So these roots are spread wide. They're oftentimes said to be bowed or flared in this area. Number 2, the roots are frequently thin from mesial to distal, quite broad, as we'll find when we study the individual teeth, quite broad from the buccal to the lingual, but quite narrow mesially distally. Gives them a ribbon-shaped appearance, particularly on these mandibular molars. Third major difference is this root trunk. They are trifurcating or bifurcating. In this instance, it would be trifurcating. Here would be bifurcating, very close to the cervical of the tooth, and in some instances, there's practically no root trunk whatsoever left. So we've got a very short, very small root trunk on these. Number 8 major difference is the cervical ridge. The cervical ridge is very prominent on primary teeth. Now, whether you want to call this the buccal deflecting ridge or the deflecting ridge of the teeth or the buccal ridge, and here it would be labial ridge, or whether we want to say that the cervicals constrict. Sometimes they'll say that the cervical constricts, but nevertheless you get a large cervical roll on the primary teeth in comparison to the permanent. Now our maxillary permanent teeth have a heavier cervical roll or cervical ridge than what the mandibulars do, but this is even much more prominent in the deciduous teeth. And this becomes very important from many operative and restorative standpoints. Again, here's a cuspid, just a general outline form. You can see a very much more prominent roll on the cervical. If we go back and look at these teeth on an individual basis, we'll go through each one of them fairly promptly. We'll find that the differences aren't real tremendous. For instance, if we were to take a primary central incisor, aside from the general differences that I've been pointing out to you, we find that the ridges on here are not nearly as prominent. For instance, we haven't got these labial ridges that develop from these three mamelons, or depressions, I should say. Labial depressions that develop from the mamelons because we basically don't have the mamelons present on the primary teeth. On the lingual surface, our marginal ridges are just not real prominent. Our mesial and distal marginal ridges are indistinct. The cingulum looks proportionally larger on it, but again, this is prominently due to the fact of this shortness of the crown from the incisal to the cervical. And oftentimes our lingual cingulum will be kind of prominent, but it's, as I say, short and squatty. But other than this, we haven't got a large number of differences. Our main roll at the cervical is a very important difference. our cervical line is not nearly as prominent in its curvatures. It still has the same basic curvature as the tooth has all the same basic anatomy as the permanent ones, but it's just not real prominent or characteristic. Mesial incisal angle is a little sharper than the distal incisal angle, and you could go right down every difference of or every main characteristic of the permanent teeth and find them here, but just not real prominent or characteristically different. Same exists on our maxillary lateral. One thing on our maxillary lateral that we never find, well, I shouldn't say never, because there'll always be somebody that'll find it. But I have never seen a lingual pit that has developed on the lingual of this tooth or actually the lingual of any of the primary incisors. Lingual pits and heavily rolled marginal ridges are very common in the permanent maxillary lateral incisors, but the primary lateral incisors, the marginal ridges are not prominent and the lingual pit is absent. Same thing exists with all the rest of the anatomy on it. Maxillary cuspid, basically the same. You get a very wide, short crown on this. Remember, this is one of the characteristics of the permanent cuspids. The crown was fairly wide in comparison to the mandibular cuspids, but here it's even wider in proportion yet. We have, again, just all basically the same characteristics on it. Same basic root form and shape and same basic cervical line. The major difference is the shortness of the crown, the heavy cervical ridge, the color, and the difference, and the things that we've pointed out to you as generalities to these teeth. We won't go through the mandibular teeth all individually, but again, same thing exists with all of them. Mandibular anteriors is that they're just miniature images of the permanent ones, with the exceptions of the general differences that we pointed out. When we get to our molars, our first molars, then we're starting to come up with some rather major differences. If we look at our maxillary first primary molar, we find a tooth unlike any permanent tooth, unlike any other tooth in the mouth. And our maxillary first and mandibular first primary molars are the ones that we want to spend probably 50% of our time on. They're very commonly in need of restorative work and oftentimes get into trouble very quickly and easily, and this is one tooth that we have to know the anatomy on, especially because it is not similar to the permanent teeth. Our maxillary one, which we have here, both of these are maxillary, are called the most atypical tooth in the mouth. They have a tremendous amount of variance. I would guess that you'd have to make the exception of the third molars, which vary more. But as far as the primary teeth and all the permanent teeth, with the exception of the wisdom teeth or third molars, this is the most atypical, has many variations on it. Let's consider some of the most commonly found anatomy. It has two very prominent cusps. Sometimes it is referred to as being similar to a bicuspid because of these two major cusps. But usually we have a smaller distal buccal cusps and sometimes even a distal lingual cusp, although one is not seen in this tooth. Here we have two cusps on the buccal and only one on the lingual. This change influences some of our terminology. We've got a mesial buccal cusp, which is the largest one by far, takes up 2/3, 3/4 of the buccal surface of this tooth, and then a very small distal buccal cusp. And then this leaves us with one lingual cusp on this tooth. We have a little different terminology in our occlusal on this tooth. We're said to have a mesial pit, a central pit with a central groove. which is oftentimes somewhat H-shaped, but then they term a ridge which runs from the distal buccal cusp over onto the lingual cusp, and they call this an oblique ridge. This is not real prominent and not usually real important, and not something that is found on all the teeth. This one here, for instance, has absolutely no oblique ridge at all. But it is listed and termed in your textbook, and you should recognize it. They're also changing the groove as it comes across this oblique ridge and calling it a distal groove. Now, generally, we have a central groove that follows all the way across the center of our teeth and the other teeth. This one changes, and right in here it's called a distal groove. Again, not a real prominent or important characteristic, but it does end up in a small pit back here, which frequently does become involved with caries and need restoration and other things, which does increase its importance on it. One of the things that's very strong characteristic about this tooth is its shape, its overall shape. It's said to be trapezoidal, broader on the buccal than it is on the lingual. So it has a broad buccal and a narrower lingual, and it tapers down as it comes to the lingual. But out on the buccal, there's this large prominence right here. And again, this is a very important and very strong characteristics of the tooth here. This is the cervical deflecting ridge. It has many names, called the mesiobuccal bulge or mesiobuccal cervical bulge. I believe your handouts just calling it buccal ridge. Your textbook calls it buccal cervical ridge because it is at the cervical of the tooth. And if we look at this from the side here, if I can get this oriented, we'll notice that this creates a very large roll at the cervical. This becomes very important when trying to restore these teeth, and particularly if you're trying to fit a stainless steel crown on it or something. Very important portion of the anatomy of this tooth. And this is different than in any of the permanent teeth. We haven't got this in any permanent teeth. Very strong here. If we look to our maxillary second deciduous molar, we'll find that really the anatomy on it is almost identical to the first permanent molar. Oftentimes my hygienist will confuse these and take a quick look at them, and she'll call this one a first permanent molar. The anatomy is almost exactly identical. The difference where you find is possibly in the depths of the pits and grooves on them. They're not quite as deep. And our overall crown length is not as great from the occlusal to the cervical. We have this heavy cervical ridge, which is particularly prominent on the buccal ridge. And of course you've got your root structure, which is entirely different on it, with a very short root trunk, if any at all, and then these wide trifurcating roots on it, which have the same names and same terms as our permanent teeth do. But from the strictly occlusal aspect, very, very similar to our permanent first molar. And the terminology on this tooth is almost 100% the same as your first permanent molar. So we really aren't picking up any new terms here. The overall size is a little smaller than the first permanent molar in most mouths. As far as the dimensions mesially, distally, and buccal lingually, as you look at the extracted teeth, you can find a large primary that might be larger than the small permanent, but within the same mouth, they're generally very similar. Here's a few teeth which show this cusp of Carabelli, or this fifth cusp, which develops out on the mesiolingual as it does in the permanent teeth. And you can see restorations that have been placed in this. This has been the weakest part of these teeth, which has broken down into carriers quicker than any other area. These are very prominent ones, but they have the same basic cusp of Carabelli as what our permanent teeth do also. If we look to our mandibulars, again, the first mandibular primary molar is a very unique tooth in so much as it has no other tooth in the mouth in which it's similar to. It is a four-cusp tooth, It is rectangular in its basic orientation and outline form, and these are all basically the same, mandibular first molar, primary molar. On our four cusps, we're terming them by the corners in which they're located at, our mesial buccal, distal buccal, mesiolingual, and distal lingual. There's differences in size, heights, shapes of these. Again, our buccal, as in our mandibular permanent, are larger in proportion, pulled closer into the center of the tooth. And again, we have a very large cervical ridge on these teeth, and this is prominently in the mesial. Mesial cervical is much more prominent than the, I shouldn't say mesial surface, but the mesial buccal portion of the cervical ridge is much more prominent than towards the distal buccal here. Sometimes this is called a mesial buccal bulge, indicating that it is more prominent in the mesial area of our buccal surface. Like most of our teeth, our mesial cusps are proportionally larger, both on the buccal and the lingual. Our distal cusps become smaller. And this is quite prominently so. Again, the mesial buccal taking up half to two-thirds of the bulk of the tooth in comparison to our distal buccal, which becomes significantly smaller. Our distal lingual cusp frequently is very small, and sometimes it'll be almost just what's called a tubercle or a protuberance on this distal lingual line angle area here. But it nevertheless is generally present and is termed and specified as such. Our central occlusal terminology within the occlusal aspect of our occlusal table is a mesial pit and a distal pit connected with a central groove. This is similar to our bicuspids, maxillary bicuspids, just a mesial pit, a distal pit, and a central groove. The one thing that is different here, and it also is very important, that is that we have a transverse ridge. This transverse ridge runs from the mesial buccal to the mesial lingual cusp. And it's a very prominent ridge, and it's a ridge which causes a great deal of difficulty in restoring this tooth, because if we can look at the tooth and the side, we'll find that this mesiolingual cusp pulls well onto the tooth. Maybe I better get that white tooth. It might show a little better. Been bleached a little more here. Pulls well onto the tooth on the mesiolingual, and also the mesial buccal is pulling well over to the center of the tooth, which leaves a very short distance between our two mesial cusps. And this ridge is quite prominent through there. And we'll find as we study into our pulpal morphology more that our pulp horns, or protuberances of our pulp, are very prominent underneath our cusps, and this is very prominent underneath these two cusps. And as you try to go between this with restorative procedures, you very frequently can nick those cusps, because if they're so close together, you can nick the pulp horns under the cusps and get into considerable amount of difficulty. If we look at our buccal surface on this, I think one of the things that's characteristic on this is that our buccal ridge is so prominent on the mesial that our enamel actually extends down onto the tooth considerably more at the buccal, mesial buccal, than it does towards the distal buccal. So we're quite prominent here, and then it tapers up as it's going towards the occlusal as it goes towards the distal. And our cervical line, which we had pointed out specifically was real important in relation to perio, becomes not typical as it is found in most of the other teeth. It's very prominent and down further onto the root in this mesial buccal area. If we look to our second primary molar, again we've got a very easy one because it is almost identical to the first permanent molar. We've got the same general characteristics of the whiteness, the heavy ridge on the buccal, and the cervical constriction or the cervical roll being very prominent. We've got a color differentiation, usually a little whiter. We've got our overall size differentiation from one tooth to another within the same mouth. But I might let you look at these and find out which you think is a permanent and which is a deciduous tooth. And it becomes fairly difficult. They each have the 5 cusps, 3 on the buccal and 2 on the lingual. They have the same basic shape to the cusp, the lingual being a little bit more pointed, oftentimes a little further from the cervical. We've got the same number of pits and grooves in the occlusal, and here we've got very similar sizes to them. And really, looking at it from the occlusal only, it would be a little difficult. But if we started to look towards the root structures, I think we could tell very rapidly which was which because of the spreading and the divergence that occurs in the primary tooth, and we get this much heavier roll at the cervical in the primary. And as I say, within the same mouth, the primary tooth will be smaller in proportion. But just trying to emphasize the similarities. And terminology-wise, the terminology is exactly the same. Sometimes these are said not to have a root trunk where the permanent does, but usually they'll have a very short root trunk on this. It's not very much on the primary. Let's take a closer look at these roots. This tooth has especially good roots. Actually, complete roots in these primary teeth are hard to find because the roots start resorbing as the permanent teeth develop and erupt. These roots are very flat. They're broad from the mesial, from the buccal to the lingual, and very narrow from the mesial to the distal. I've got some other roots here. I'll show you a set of 4 of them here. These are a little unique in so much as they all came out of the same mouth, and they all came out almost completely intact. We had some caries that was twinned, that occurred in the same spot on both sides of the mouth, but here's a marking from last year's final exam, I see. Identify the root on this tooth. Same basic principle, except they're just wider spread on it. Lingual root being the longest, and a little bit on the round side. The broader flat one is the mesial buccal root. But if you have a chance to have these in your hands, you'll be able to see them and tell the difference. And this gives a good opportunity for a premolar crown to form right in the trifurcation here. Let's look at some of the resorption patterns that do exist on these teeth. We indicated that on eruption, frequently that the anterior teeth come in a little bit to the lingual. So we'll find that if these teeth are taken out in the process of their the roots being resorbed, that frequently the resorption will be to the lingual on our anterior teeth. Of course, sometimes our anterior teeth will end up, like this. This is the way we'll see most of them with absolutely no root on at all. They come out by themselves. This also, becomes a problem if you have to start restoring these teeth. These are small teeth, and I had one here that had a carious lesion on it, but if you're to have to start restoring carious lesions on these, you'll find that it's rather difficult because of overall size. When we get to our molars, they'll resorb in many fashions. You can see right through this one, it's gotten so thin. This becomes a problem when these primary teeth abscess and you start removing them. You've got these very, very thin spicules of tooth structure left, and they're hopefully capable of being removed without being fractured. Or if they are fractured, they have to be retrieved, and you got to know where they are and how they are and what to expect on them. These resorb from the inside of the trifurcation or bifurcation area, and they get very thin to the outer surfaces on it. Take a tooth like this. This resorbed so far that it even resorbed right up through the center of the crown of the tooth. Just wasn't anything left except an enamel shell by the time this one got ready to come out. Just a real thin enamel shell. One of the main restorations that can be used on this, I shouldn't say it's a main one, it's an occasional one. It's one that tests your anatomy rather significantly when you have to start adapting these stainless steel crowns. I had a patient in the office that complained severely about her child had a crown that was falling off that I put on. I wanted to see him, so when we got a chance to see him, we found that it was a stainless steel crown had been put on 9 years previously, and the tooth was just loose and ready to come out, and the root structure was almost completely dissolved off of it. But you'll get involved in trying to adapt these crowns on when it becomes that necessary, and you've got to know the outline form, you've got to know the general size, where the deflecting ridge is the heaviest and most prominent, and all your anatomy starts coming into place. If we can go back to a couple slides, we may point out the mixed dentition. We get an opportunity in the mixed dentition to see differences in size here. Two of them present within the same mouth, central incisors. Very significant size differentiation that exists. But this is a period in which we have both teeth present, and you've got to be able to identify them. Very common question by parents is this a baby tooth or is it a permanent tooth? And oftentimes students say, well, this is not, that important. We can always tell which is which, and sometimes it becomes very important because some of these are good permanent teeth and some of them are decayed primary teeth. And you've got to know which ones are in need of coming out and which ones are in need of staying in. And when they're lined up in such a manner, the x-rays can become confusing and your anatomy becomes very important. We've got primary teeth here, another primary molar here, which are due to be out and need some help getting out because these other teeth are being deflected to the buccal. And so we have to identify these teeth in the mouth. Frequently they'll be in combinations or have 2 or 3 of them. But if we're going to get our patients from a state of mixed dentition and from a state of disease to the permanent ones, we've got to be able to know our anatomy. Why are the baby teeth important? You'll have it asked you a million times, and since you're now all experts on this, point out to you the 2 most important reasons. One is pain. You get abscess, you can get rather severe pain in these youngsters, and this is not nice. Appearance is important, and it may have significant psychological effects on it, but I don't list it as the number two most important reason for taking care of these deciduous teeth is to help the permanent teeth come in straight. If you start losing deciduous teeth before they're due to be lost, the chances of having crooked permanent teeth are much greater. Man-made crowding, we call it. And once you get crowding, the ability to keep it clean becomes much bigger, and the disease can just produce much more rampantly. So if we expect to guide our patients into a permanent dentition, which is desirable, we've got to know the anatomy of these deciduous teeth from many, many respects. Take a look at the pulpal morphology on these primary teeth. In the anterior, we can remember that our root structure is basically the same as our permanent teeth, and our external morphology of our root determines rather significantly the internal morphology. Now, when we come to our molars, we've got one major difference, and that is our mesial distal width of these roots. They are very thin, mesially distally, and also very wide from the buccal to the lingual. And it's this width that gives us a very flat, ribbon-shaped canal on the inside of these teeth. A very narrow width mesially distally, and very wide buccolingually. Actually, we're not as concerned about the root canal structure on the inside of these teeth as we are in the permanent teeth, because in the primary teeth we don't get to treating these root canals with permanent restorations very often because of the resorption that occurs. We're more concerned with the crown morphology of the pulp. And let's go to some models and diagrams and some slides here, and we'll discuss a little bit of the crown morphology of the pulp. This is the pulp chamber morphology. As we indicated, these pulps are usually proportionally large. We'll start with our largest tooth, which is our mandibular second primary molar. And here we have three canals, three pulp horns rather, I should say, to our buccal. We've got our mesial buccal pulp horn, our distal buccal pulp horn, and our distal, which they've got into this cutaway section. Actually, if we were to look at the pulp itself, taking away the tooth, and this is just a model of the pulp without any of the surrounding dentin or enamel over it, we find that the pulp structure itself, the pulp horns and the pulp chamber, follow very closely the external anatomy on these crowns. This is the first time we've had a chance actually to view the pulp in this manner, but we've got 5 pulp horns on this tooth, as we've got 5 different cusps. And then, of course, in the central groove, central fossa area, where we get a rather significant depression in the tooth, we have a rather significant depression in the pulp. If we were to take this and superimpose it over a tooth, we'd find that these pulp horns correspond rather significantly with the different cusps, one pulp horn being almost directly under each of the cusps. If we look to our mandibular first molar, we'll find that generally speaking we've got a rectangular pulp chamber. Now this is just the pulp now, again with the enamel and the dentin completely removed. The shape of it is rectangular as the crown of it is. And again we've got basically the pulp horns in this that we have crowns, the same shape, the same basic positions. If we superimpose this into a tooth, again we find that the pulp horns are directly underneath the various cusps. If we look at a cutaway of a maxillary, we see a little bit of the proportion of the size, the thinner enamel, the proportionally larger pulp. And again, we can see that we've got our low height of contour on the buccal, close to the cervical. Therefore, we've got our buccal pulp horn and a lingual pulp horn on the other side. If we superimpose this, well, this is just a view here of the pulp itself, again with the enamel and dentin gone. It gives you a little bit of a different view, but if this was white, you'd probably think this enlarged pulp to be the actual tooth, because the pulp chamber, pulp horns, really are identical almost to the external morphology of the teeth. Again, if we transmit this to being inside of the tooth, we'll see that the relationships are very similar. This is a second molar here, second primary molar, and we can tell this by our small fifth cusp, which is actually in the area of our cusp of Carabelli, or the fifth cusp that occurs out on the mesial lingual area of the tooth. Actually, I think that in summarizing, the thing that we really need to remember in relation to the pulpal morphology of the primary dentition is that it follows very closely the external morphology of the tooth, both in the crowns and in the roots, but that the total pulp size is proportionally larger than what it is in the permanent teeth.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.